But here's what I'll say about Steve that I think is most important. I trust Steve. I sent my daughter to see Steve when she developed Lyme disease. I think he's an outstanding physician. Thank you.
I'm going to talk on assessing and treating toxicity in Lyme patients. And as Dan said, and as we all know, we're all exposed to heavy metals. We're all exposed to chronic chemicals. So this is really important. So from a Lyme point of view, what is our aim? Eradication of the microbes responsible for disease, either using antibiotics, herbs, removal of toxins, microbial, neurotoxins, molds, chemicals, metals, etc. Treatment that supports and stimulates the body's own regulatory systems. Recognition of the natural cause of illness in the body, as Dan so eloquently said, and understand what health is and how to restore it. So, meaning what your context is. We were talking before about physicians being not open to things. And way back 30 years ago, we talked about vertical disease, horizontal disease. And we all learned horizontal disease. If you're in the hospital in the ICU, you get great care. But when you're walking around with vertical, wounded, you don't really get care in a lot of institutions in our country. So an overview. I'm going to go through statistics, environment, toxicants, metals, toxic load, mechanisms of toxicants, symptoms, assessment, and treatments, detox, metal detoxification, homeopathic, methylation, Shoemaker, mold, toxins, Wayne, and Dr. Nathan will cover. So there's over 80,000 chemicals since World War II that have been introduced into our environment. In '94, 2.2 billion pounds of toxic chemicals. In 2002, 4.7, and last year, 10 billion pounds per year. Mercury, 47 million pounds per year dumped into the environment. And we all know that there's a lot of literature out there on Xenobiotics causing serious health problems. Bisphenol A is an endocrine disruptor and causes epigenetic effects. The FDA Total Diet Survey found increased chlorinated pesticides in 63 to 100% of food, so it's all around us. And a dietary study of Arctic indigenous women were found to be high in organochlorinated compounds because it's in the water, it's in the rain, it's around the whole earth. There was an article by Sears Regional Centers and International Health Organization to note considerable time to the issue of toxicant exposure and bioaccumulation of xenobiotic materials in the body, but a direct connection to the prevalence of chronic disease is rarely made. And this is Sears, he published this in 2012. So we all know that there's arsenic, cadmium, lead, aluminum, mercury in our drinking water, foods, amalgams, pesticides, etc. They bind with sulfhydryl groups in proteins and inhibit enzyme function. Accumulate in organs such as the brain, kidney, liver, bone, etc. And what's the mechanisms of toxicity? Well, it's a web effect. It affects the nervous system, the GI tract, the immune system. And it's an interaction between all the toxicants, so it's synergistic, and they affect metabolic and physiologic pathways.